Hey there. So I have a ton of friends who are in a tremendous amount of pain with their backs recently. I'm going to go through a few brief segments for low back pain that is acute at the time. And then the next segment that you'll see in a couple of weeks will be preventative maintenance for chronic low back pain. Generally speaking, you have tension through either side of your spine through what's called the QL, the quadratus lumborum, or you might actually have L4, L5, or L5S1 inclusion. So there's some disc issues, whether it's bulging or slipped or herniated. Those can impact your ability to move, and you may throw your back out because you're overcompensating. So I'm going to bring you through a couple of basic movements if you are in a state of acute pain right now. So if you've thrown your back out and you need to start stretching, these are some moves that you can do. You're going to have something behind your head. Generally a folded blanket will work. You just want to support the head so that you can take the natural curve into your neck. So that might mean taking a roll underneath the neck and just letting the chin lift up. Laying down with your hips onto the floor, walk your heels in, and very gently, all you're going to do is draw your tailbone toward your heels. So you're flattening out the low back onto the floor. Lower that down. Breathe in to tilt the pelvis. Breathe out to lower down. No squeezing through the glutes. It might help to take a small ball or a block between the knees and squeeze that. That will prevent you from squeezing through the glutes. Do this about 5 times. Every breath in, you'll simply tilt the pelvis so that the tailbone draws toward your heels and the low back flattens out. Next, you're going to draw the heels of the hands right into your hip crease where your hips meet the upper legs. And you're going to press right into that crease. So what you're doing is you're drawing the femur bone into the hip socket. Again, you're going to tilt, press, lower down. Tilt, press, lower down. You're going to do that about 5 times. If you are mobile enough, draw your knees in toward your chest. With your hands to your shins, as you breathe in, press away from the body gently. And as you breathe out, pull back in. Breathe in, push out. Breathe out, pull in. You'll do that about 5 times. Again, if you are mobile and it feels okay, extend one leg down and draw your opposite knee into your chest. You're stretching here through the piriformis up over the glute. And when the glutes are tight, your low back gets tight. You can stay here or you can twist if you feel comfortable and the pain is not intense at this point. So if you're a few days into your recovery, you can twist by drawing the knee across the room. That's going to include low back and outer hip. You'll repeat the same thing on the other side, holding each of the poses for about 3 long, deep breaths. Having a support of a pillow underneath the knee if it doesn't reach the floor will be helpful. Now that will probably be enough if you're just coming off throwing your back out. If you're about a week or so into recovery, the next stage would be to lengthen out the hamstrings by taking this next series. You're going to loop any kind of strap or belt, even if it's a belt that you would wear with clothes, around the ball of your foot, and then draw the heel of that foot to the ceiling. You're immediately going to feel the stretch through the back of the leg and the hamstring. As you breathe in, you'll press the heel upward, and as you breathe out, just gently draw the toes back. Again, 3 to 5 breaths here. Taking the belt into the same hand, you'll open out to the side, getting into the inner groin now. So your low back is connected to everything in your posterior chain. Inner groins, hamstrings, quadriceps, outer hips, hip flexors. Come through center very gently. Take the belt into the opposite hand, and without lifting the hip up, you're going to keep the hip rooted to the floor and just gently guide the big toe toward the opposite shoulder. You'll feel the entire outer leg stretch. releasing that stretch. You'll reach with the same hand for the inside arch of the foot and draw the foot outward, stacking ankle over knee, getting inner groin and hip crease. So you're drawing that hip down and the femur bone deeply into the hip socket. Again, you'll take the same series on each side, holding for 3 to 5 breaths in each pose. Next, cross one ankle over the opposite knee, and you might feel fine here, just pressing into the femur bones, the upper thigh bones. Otherwise, maybe you have the mobility to draw into your chest and work that bent knee away from your body. Again, getting across the piriformis and your outer hip in your abductors. Releasing that down. This is a bit more advanced, so if you're further along in your recovery, you can drop down and take a twist. You're going to get into your SI joint and across your QL here. And taking that same series on the other side. Finishing by drawing the knees into the chest and gently circling the knees 3 times in each direction. Anytime you come from a supine position on your back to a seated position, if you have a bad back, you should roll to one side, bent knees, push up with your hands, and then come to seated. And from there, come to standing. So one more that I'll take for you that you will be able to do if you are somewhere in your first 1 to 2 weeks of recovering from a back strain will be a cat-cow, which is simple flexion and extension of the spine. As you breathe in, your belly will drop down and your chest will draw through the gateway of your shoulders. As you breathe out, you'll tuck the chin, tuck the tailbone, and draw the belly button right up to the spine. So you're rounding. You'll take about 5 of these. And then you can press your hips gently back to your heels and release your low back into a neutral position. From there, walk your hands to one side, pressing back through the opposite hip to get a stretch across the side of the waist. And then take it in the other direction. So this simple series is kind of a starter series for acute low back pain brought on by trauma. And then as you come into your first 1 to 2 weeks of recovery. I'll do another series next week that will show you some preventative maintenance that will allow you to loosen up the areas through the posterior chain, open up the QL, and start to bring your back into neutral. And then the next series will be strengthening through the core so the front of the body supports the back of the body and allows you to prevent the injury from recurring on a frequent basis. Hope you're feeling better soon.